Welcome back. To suppress the spread of COVID-19, the government announced to tighten large-scale social restrictions, or PSBB, in a number of provinces in Java and Bali. The PSBB tightening will be implemented from January 11 to January 25th, 2021.
To suppress the spread of COVID-19, the government announced to tighten large-scale social restrictions, or PSBB, in a number of provinces in Java and Bali. The PSBB tightening will be implemented from January 11 to January 25, 2021. The government's decision was conveyed directly by the chairman of the Committee for Handling COVID-19 and National Economic Recovery, Erlangga Hartarto. Erlangga stated that the decision was in accordance with Government Regulation Number 21 of 2020 concerning large-scale social restrictions in the context of accelerating the handling of COVID-19.
Dipandang perlu untuk melakukan pengendalikan kenaikan kasus COVID melalui kegiatan-kegiatan pembatasan berbagai aktivitas di masyarakat. Nah, kemudian juga pemerintah melihat beberapa hal yang perlu dilakukan pembatasan dari kegiatan masyarakat yang berharap tentu penularan virus COVID ini bisa dicegah ataupun dikurangi seminimal mungkin.
In taking this policy, Erlangga said that the government looked at the data on developments in handling COVID-19, such as the risk zone for coronavirus transmission, the ratio of the occupancy of isolation beds and the ICU. In addition, the government also sees active cases of COVID-19, which currently have reached 14.2%. From all sources, for IDX Channel.
The government has set large-scale tightening of social restrictions in a number of provinces in Indonesia. Java and Bali are the main targets. But in which cities and districts do these restrictions apply? And what are the parameters used by the government? Let's take it through the next graphic. This is the implementation of tight, large-scale social restrictions. Will be implemented in 11 till 25th January 2021. In Banten, the PSBB, or the tight PSBB, will be implemented in Tangerang City, Tangerang Regency, South Tangerang City. Meanwhile, in Jakarta, all cities will be following the implementation of tight, large-scale social restrictions. In West Java, we have Bogor, Depok, Bekasi, Bandung, Cimahi. Meantime, in Central Java, will be implemented in Semarang, Solo, and Banyumas. Meantime, in Yogyakarta, Gunung Kidul, Sleman, Kulon Progo, East Java, Malang, and Surabaya. And of course, Bali will also do the same, implementing the tight, large-scale social restrictions. And some areas that will be also implemented the same thing in Denpasar and Badung. The coordinating minister for the economy, who is also chairman of the Committee for Handling COVID-19 and National Economic Recovery, Erlangga Hartarto, in his statement revealed that the policy was taken because the government was referring to data on developments in handling COVID-19, such as the risk zone for coronavirus transmission, the occupancy rate of isolation beds and ICU, as well as active cases of COVID-19, which currently have reached 14.2%. He also emphasized that the PSBB tightening doesn't mean the prohibition of activities in public spaces. And as stated by the government, the decision of PSBB tightening is based on a number of parameters. And what are these parameters? Well, check it through the next graphic. These are the main parameters of Java and Bali tight large-scale social restrictions. Occupancy rate of hospital beds above 70%, regional recovery rate below the national level, and regional active cases of COVID-19 over national cases, and regional death rate above the national level. And as an illustration, currently the hospital bed occupancy rate in Jakarta, Banten, and West Java is above 70%. Likewise, Yogyakarta and East Java also recorded a bed occupancy rate above 70%. From several parameters, a number of provinces or regions are known to fulfill at least one of these parameters. Therefore, the government stated that each governor or regional head in each province or cities will make a more detailed regulation. And viewers, regarding the tightening of PSBB, what is the scope of restricted public activities? Let's take it through the next graphic. This is the scope of tight, large-scale social restrictions implementation. First one is 75% work from home policy for offices. Teaching and learning activities are carried out virtually or online, and the essential sector continues to operate 100% with strict regulation on operating hours, capacities, and health protocols. Limiting the operating hours of shopping centers until 7 p.m. will be mandatory. Maximum dining capacity at a restaurant cafe or a cafe is 25%. Construction activities are allowed to operate 100% with the application of stricter health protocols. Maximum capacity of places of worship is 50% with the implementation of stricter health protocols and temporary suspension of public facilities and social and cultural activities, and adjustment of capacity and operating hours of transportation modes. In these PSBB, we can see that government is trying to tighten the health protocols, even though in the same time, some activities are still allowed to remain operating, such as construction and the essential sectors. But one interesting thing regarding this tightening PSBB is public policy observer Agus Pambagio assessing that the PSBB policy and this restriction is too late. The reason is the number of positive coronavirus or cases in Indonesia is already high and difficult to suppress. Even though it is too late, Agus respects the government's steps and policies, but he is not sure that this PSBB step can be effective. In the law enforcement is still weak, especially from all provinces. In Java and Bali, only Jakarta and East Java have related regional regulations imposing sanctions for violators of health protocols in the form of imprisonment and fines. Meanwhile, not only tighten the PSBB to suppress the spread of COVID-19, the government has previously provided leaks related to the COVID-19 vaccination program and schedule, which will also begin this month. To more clearly know the vaccination schedule, we're going to check it through the next graphic. This is COVID-19 vaccination schedule in Indonesia. Stage 1 and stage 2 will be implemented, or will be, or we can say they will do that in health sectors and supporting personnel and public service officers and elderly group over 60 years. Meantime, stage 3 and 4, April 2021 to March 2022, will be given to vulnerable communities from geospatial, social and economic aspects, and society and other economic actors by using cluster approach according to the availability of vaccines. Regarding vaccinations, the government has distributed and sent the COVID-19 vaccine to various regions, where based on the plan, the government plans to vaccinate the COVID-19 vaccine on January 13th, 2021. Even President Joko Widodo is also declared to be the first person to be injected the COVID-19 vaccine, even to be continued simultaneously in 34 provinces in stages. Even though vaccination will start, the public is required to remain disciplined, as said by the chairman of BNPB, Doni Monardo, who asked the public to discipline in applying 3Ms health protocol, namely wearing face mask, washing hands, and maintaining physical distancing. And hopefully the tight social restriction measures that will be implemented on January 11 will be able to reduce the spread of the coronavirus in Indonesia. Stay tuned on Market Headlines because we'll be right back after the break.